All right, guys. Today we are going to talk about history and trends in the healthcare field. So we're going to talk about the history of the healthcare field up to the 20th century or the 1900s. So there's a lot that we have going on in the world of medicine that happened before we were all around. So it's good for us to know what's going on before we were here, so we kind of know where the healthcare field came from, so we know where it's going. So if we look at the history of healthcare, a lot of what we have is from ancient times. A lot of our medications that we're even using today are from ancient remedies. So if you guys are familiar with the drug aspirin, aspirin actually comes from a herb and a root that they've been using for many, many, many years to help heal pain and to help with pain. So lots of these herbs and plants and foods that we've been using for hundreds of years, we have started to discover what the specific agents in those things are and extract those agents and make them stronger. And that's where we get a lot of our medicines from. So where we came from is just as important as where we're going, because we got to know how we got to where we are. So if we look at ancient times, we know that ancient times, they didn't know everything about medicine. They didn't know what caused sickness and disease. They thought that sickness and disease was actually caused by evil spirits or demons, or that you have ticked off whatever god you're worshiping, that they are angry at you and they are bringing disease upon you. However, as far back as the ancient Egyptians, we started to realize that we could keep records of this stuff, and what's happened to you in the past is important to know what your future is for your medical record. So even the ancient Egyptians started recording health data on patients so they could keep it for the future. There's actually an ancient Eastern medicine technique from the Chinese that to cure the body, you have to cure the spirit. So they believed that there was a big tie between the body and the spirit, and that's what made people healthy. So there's actually some truth to that. You can start to see things that if you, such as like the placebo effect, if you believe something to be true, a lot of times it has an effect on your body. So they were onto something there, but there's more details that you can kind of get into that. Then we start to get to the Greeks. You start to see with the Greeks something that could almost be considered medicine. Couldn't quite call it medicine yet, but they are treating illnesses with medication. They're looking for symptoms and they are treating those symptoms with herbs and other type of nutrition or cleanliness, and some of the things that they're doing really work. Some of the things that they're doing don't work that well, but they're starting to think along the same lines as people who are today's doctors. Then a big contribution to the next crew, we got the Romans. The Romans come after the Greeks, and the Romans were really good about cleanliness and order. The Romans were very organized as a society. They built a lot of roads, and they built a lot of ways to make sure that things are clean. And they came up with the first system of aqueducts for clean water. So if you think about this, before that, all of the waste material that people were having was just put into the street. So all of that human fecal material or food waste was just hanging out in the road and causing a bunch of rot. So the Romans came up with a very complicated and impressive system to get rid of waste material and bring fresh, clean water to the people's houses. Now, the problem with that is it didn't stretch beyond the Roman Empire, okay? So they didn't make that a worldwide phenomenon. It was more of a localized phenomenon. And as we discussed, a lot of diseases, we hadn't figured out the causes of them, and a lot of times it killed the people. In the Dark Ages, we call these ages the Dark Ages because not a whole lot scientific or medical happened in these times. So they were going back and studying the Greeks and the Romans, but not a lot of new discoveries were really happening during this time. We did start to have some medical schools to be established, and those medical schools were established to make sure that surgeons and doctors were actually doing consistent things, and it wasn't just somebody kind of going off on their own and doing their own thing, that they were actually being consistent. Then in the 1300s, during this time frame, we had a really big outbreak of the bubonic plague. And the bubonic plague was potentially scary because it was killing a lot of people, and they estimate up to 75% of Europe and Asia actually died because of the bubonic plague, which is scary. But at the same time, you don't have to worry about the bubonic plague today because we actually have a cure for it. It's just an antibiotic, and all you got to do is take that antibiotic and it gets rid of it. But people still can catch the plague today. Then we get to the age known as the Renaissance. So the Renaissance is a large period of time between the 1300s and the 1600s where people start kind of waking up to science and medicine, and they start thinking like scientists. You might also hear in this time frame, there's a time that we call the scientific revolution. And people started thinking scientifically and publishing medical books and also publishing books because the printing press was invented. They also started doing human dissection so that they could study what was going on in a small level of the human body, and they could actually see inside the body as opposed to just kind of guessing what was going on. Then in the 15, 16, and 1700s, we are after the Renaissance, but we are still growing in our understanding of the human body. Something that was really helpful is the microscope was invented. So we could see super itty bitty tiny things that are smaller in the human eye, and we could start to look at things like cells. Then we also had the first apothecaries or pharmacies that were invented, and they started selling medicinal treatments for cure or for ailments, for diseases. So they started doing these things. Now, they were not super regulated, so sometimes people could just kind of go crazy and they could start selling whatever they wanted to. But these early pharmacies started popping up, and they were using medicine to treat disease. And we also had the first vaccine developed, and it was the smallpox vaccine. And let me tell you that story really quickly. So a guy named Edward Jenner actually started discovering that there were people who were not catching smallpox. And there was a group of people that were called milkmaids that were working with the cows. And when those people were working with the cows, they were catching unbeknownst to people at the time, they were catching a smaller form of smallpox that was known as cowpox. So if you caught cowpox, you were actually less likely to catch smallpox and get disfigured and or potentially die. So Edward Jenner infected his nephew with cowpox, let it kind of run its course, and then he infected his nephew with smallpox, and his nephew did not catch smallpox because he had developed the first vaccine. And the science behind that is his immune system basically got warmed up to treat smallpox without having the danger of having smallpox. So his immune system kind of got, Edward Jenner's nephew's immune system got tricked into thinking that it had been exposed to smallpox, but it actually hadn't been, which is pretty neat. Then we get to the 19th century, and a big part of the 19th century is the Industrial Revolution, which the Industrial Revolution brought machines that could make things in factories, which allowed us to get a lot of medical instruments, and it allowed us to invent things like the stethoscope, and it allowed us to mass manufacture things. This is also whenever we started coming up with the idea that microbes, itty bitty tiny things that we can't see, are what are causing our diseases, so that we need to maybe wash our hands to prevent these microorganisms from getting inside of our bodies to make us sick. We also started doing lots of different training programs for nurses to make sure that nurses weren't just people who were helping out, but they were medically trained to be able to be good at treating specific diseases. All right. Well, that gets us from the dawn of time to the 19th century, and I will come back tomorrow for the 20th century. See you guys later.